Thank you, Madam President and colleagues. And first to my colleague in Covina, I want to congratulate him on the many years of service in the state of California and embracing a lot of programs that have helped a lot of people. I recognize that, sir. My friends, Donald Trump is President of the United States. He ran on the issue of repealing and replacing Obamacare. We've talked about the rush that the Democrats did during the formation of Obamacare. We've heard the quotes about Nancy Pelosi that we'll figure out what's in it after we pass it. In my neck of the woods, I represent a lot of middle-class, blue-collar workers. And what have those workers seen in the past 8 years? They saw their premiums rise. They saw their deductibles become catastrophic, $5,000, $6,000 per person, to the point where they could barely afford it. One person said that Obamacare was the craziest thing in the world. Do you remember who that was? That was former President Bill Clinton speaking at a Flint rally. And while you can claim that the goal of Obamacare was laudable, the bill has done very little to improve the lives of most Americans, and in numerous ways has made things worse. Let's go through some of those. I'll call it lie number one. Obama famously said, "Michelle and I don't want anyone telling us who our family's doctor should be. No one should decide that for you either. Under our proposals, if you like your doctor, you can keep your doctor." Well, we all know that that backfired horrifically, as Republicans predicted it would. Insurance companies across the country limited access to doctors in order to keep their premiums down. Lie number two. Obama famously said, if you like your current plan, you'll be able to keep it. Let me repeat that. If you like your plan, you'll be able to keep it. Well, that backfired tremendously, as Republicans predicted it would, as hundreds of plans disappeared because they didn't meet the restrictions put forward by the Obamacare administration. According to MarketWatch, in 2016, many states have lost more than 80% of their insurers. Alabama went from 23 to 3, Arkansas went from 24 to 4, and Wyoming 21 to 1. New York lost almost half of its insurers, going from 28 to 15, a 46% decline. Many of the nation's biggest insurance providers have been forced to withdraw from the Obamacare marketplace after losing billions of dollars. This occurred in part because there have not been enough healthy people signing up for the insurance to counteract the cost of providing care for older, less healthy enrollees. And last lie, Obama famously said the Affordable Care Act will reduce annual premiums by $2,500 for a typical family. This might be the biggest lie of them all, as premiums have skyrocketed across the country. My friends, the co-ops have not been successful. Out of the 23 co-ops established under Obamacare, only 7 are running. The state's exchanges are bleeding insurers. The Obamacare enrollment numbers have not been up to par. They had hoped to insure 22 million people, but so far only 11 million have been insured. Premiums are projected to increase in 2017. The number of uninsured Americans is projected to increase as well. Healthcare spending has also increased under Obamacare, and most Americans that have had to deal with Obamacare have reported negative experiences on it. I could stand here all day and recite fact after fact and tell numerous stories about how Obamacare is failing. There's a mountain of evidence that this resolution fails to recognize. We all believe that people should get health care in this country. In fact, prior to Obamacare, and even with Obamacare, and even with, as you call, Trump care, everyone living in the United States gets health care. No one goes without getting cancer treatments. Nobody goes without getting diabetic treatments. They go to an emergency room. They go to a hospital. By law, under federal law, if the senator from Santa Barbara hears this, they have to provide treatment. They cannot deny anybody. The bill that's in Congress right now is in its infancy. And it's interesting to note that in the resolution, It says that Congress to not jeopardize the health of millions of Americans by pushing through irresponsible policy in late-night hearings, but allow for comprehensive public review. Is there a different standard for Congress than there is for the state Senate? Because I've been here for the past few years, and towards the end of session, we do things late at night, and you rush things, you warp things to the floor without any possibility of comprehensive debate on issues that I think are just as important as healthcare issues. So we need to start, following our own recommendations for Congress to follow. I think it's irresponsible to say on the Senate floor to our senior citizens in this state that their premiums are going to go up. I think it's irresponsible to say to the LGBT community that we're going to take services away from you and your medicines are going to go up and we're not going to provide access for you. It's not even a law yet. But I understand the hysteria that this body has this obsession with doing everything they can to poke this president in the eye, understanding that we need to work with him to find common ground for the best interest of this state. So, my friends, let's not support this resolution. Mr. Trump, if he plans on running again in 4 years, I don't think he's going to alienate senior citizens. I don't think he's going to alienate middle-class America. Before we level these kinds of criticism against the president and his administration, let's see what the final law looks like. And it's my hope that it's going to be a drastic improvement over a failed Obamacare law.